The basic anatomy for the respiratory diaphragm includes its origins, its insertions, and its actions. So the origins for the respiratory diaphragm, which runs across the body and divides the abdominal cavity from the thoracic cavity. The origins are the interior surface of the lower 6 ribs, so ribs 7 through 12, the anterior surface of the bodies of L1 through 3, and the xiphoid process of the sternum. So the xiphoid process is that little triangle that hangs down from the sternum. The insertion for the respiratory diaphragm is its own central tendon. So all of the fibers come from all directions to come in and insert right into the central tendon of the diaphragm. When relaxed, the diaphragm sits like this. So it's kind of concave or convex, depending on how you're looking at it, with the middle of it moving up toward the throat. The action of the respiratory diaphragm is that the central tendon pulls down, pulls inferior, and begins the process of inhalation. So as it pulls inferior, we begin to breathe in and take a breath. So all of the action for the respiratory diaphragm is breathing. So you would think that if the muscle is actually overly toned or too tight, that it would come from a lack of breathing. And that does happen in our world, obviously, is that people don't always breathe deeply. They don't always breathe fully. But the respiratory diaphragm can also become tense from things happening in the lower rib cage. So ribs can become misaligned quite often, and particularly your floating ribs. There are times when your 12th rib can actually be rolled up underneath your 11th rib, and that can cause all kinds of tension in that side of the respiratory diaphragm. So look for things that are happening to the rib cage as well that might be causing the issue. Sometimes what's happening to the rib cage is actually happening because of the position of the hip bones or possibly the position of the shoulders. So the issue can be more widespread than just what's happening to the rib cage. And at times what's happening to the rib cage can be because of musculature, specifically, let's say, musculature in the abdomen, because we have a tendency to sit in a very kind of slumped position. This shortens the abdominal muscles, and that can actually bring the ribs more forward and inferior in toward the abdominal cavity. And that's going to shorten certain fibers of the respiratory diaphragm. The other thing to know about the respiratory diaphragm is that the fibers of the origin on the anterior bodies of L1 through L3, those fibers actually blend with the origin of psoas major. Psoas major originates from the anterior bodies of T12 through L5. And so those fibers actually kind of blend together. So psoas major is affecting the tension in the respiratory diaphragm, and the respiratory diaphragm is affecting the tension in psoas major. So know that those two are very connected to one another.